Most owners who feed their dog wet food every day have a feeling it's probably fine, maybe even good, and most owners who feed dry kibble exclusively have a feeling the same thing. The truth the research gives is more specific than either camp usually has access to. What actually happens inside your dog's body when wet food becomes their daily diet, in their kidneys, their bladder, their mouth, their digestion, is documented with surprising precision, and some of what it shows will make you look at your dog's food bowl very differently. 1. Their hydration changes, and that changes almost everything. Wet dog food is approximately 70 to 85% water by weight. Dry kibble is approximately 10% water. This difference is not minor. It is the single largest biological consequence of choosing one format over the other, and its downstream effects touch nearly every system in your dog's body. Dogs are what physiologists call reactive drinkers. Research published in PMC confirms that dogs are triggered to drink primarily by a rise in plasma osmolality, meaning their thirst mechanism activates only once dehydration has already begun. Unlike humans, who drink somewhat proactively, dogs tend to operate in a mild state of dehydration and respond to it rather than preventing it. This is not a design flaw. It is simply how the canine water regulation system works. But it means that voluntary drinking alone may not fully compensate for the water demands of an active, dry food-fed dog, particularly in warm weather, during illness, or in conditions of high activity. A 2025 PMC study on fresh and canned food feeding measured total daily water intake in dogs consuming high-moisture diets versus those consuming lower moisture options. Dogs consuming the canned food consumed significantly higher total water intake than those on the comparison diet, well exceeding 100% of their calculated daily water requirement. The high-moisture diet dogs were, in the language of the research, consistently meeting their hydration needs without relying on voluntary drinking to compensate. What this means physically: your dog's organs receive more fluid daily. The kidneys, whose job is to filter waste and regulate electrolytes, are doing that work in a well-hydrated environment. The urine being produced is more dilute, which has its own specific and documented consequences, which we'll come to next. 2. Something significant happens to their urinary system. This is where the hydration benefit becomes medically concrete. Bladder stones and urinary crystals uroliths are among the most painful and costly conditions in canine health. Struvite and calcium oxalate stones are the most common types, accounting for the vast majority of cases, and the formation of both is directly related to the concentration of minerals in the urine. The more concentrated the urine, the higher the risk that mineral precursors reach the saturation point, where they begin to crystallize. The VCA Animal Hospital Guidelines on Nutritional Management of Urinary Stones describe the mechanism precisely. When urine is diluted, the same amount of mineral is dissolved in a greater volume of fluid, reducing the likelihood that any compound reaches the concentration necessary for crystal formation. The analogy used in the veterinary literature is straightforward. A teaspoon of sugar dissolves invisibly in a full glass of water, but settles at the bottom of a teaspoon. More water in the system keeps the minerals dissolved. Wet food is the most effective dietary strategy for increasing urine volume and dilution. The PetMD guidance on bladder stone management states directly that wet food is the most reliable way to keep urine dilute, and that adding equivalent water to dry kibble would require adding several cups, making it impractical for most dogs to consume enough food for their other nutritional needs. The ACVIM consensus recommendations on uroliths, the authoritative clinical guidelines from the American College of Veterinary Internal Medicine, published in PMC, include increased water intake and urine dilution as a primary prevention strategy regardless of stone type. Dogs on wet food daily are, without any additional intervention, producing more dilute urine every day. For dogs prone to urinary crystals, stone formers, or dogs with early kidney disease, this is not a minor benefit, it is a foundational one. And if this is already making you rethink what's in your dog's bowl, hit like and subscribe. This channel covers the science that changes what you do tomorrow. 3. Their mouth changes, and this part is nuanced. Here is where the picture becomes less uniformly positive, and where the research requires careful reading. The Ober et al. 2022 study from the University of Illinois, the first study to examine the oral microbiome specifically in dogs consuming wet versus dry food, used 12 healthy adult dogs in a controlled 6-week intervention. Dogs were fed either wet or dry food, and researchers measured plaque coverage, breath odor, salivary pH, and the bacterial populations present in supragingival and subgingival plaque using next-generation sequencing. The results were directionally consistent with what has long been suspected. Dogs consuming dry food had lower plaque coverage, lower breath odor, and higher salivary pH than dogs consuming wet food. In the oral microbiome analysis, dogs on dry food had higher relative abundances of bacteria associated with oral health, Pasteurella, Capnocytophaga, Corynebacterium, and lower relative abundances of bacteria associated with periodontal disease, including Porphyromonas gingivalis, Treponema medium, Tannerella forsythia, and Phyllophacter alosis. A 2025 study in Yorkshire Terriers in BMC Veterinary Research replicated these directional findings, though it added an important caveat. Despite the microbiome shifting toward a healthier profile in dry-fed dogs, there was no evidence of improved periodontal health in terms of actual clinical outcomes. Both studies concluded that additional dental hygiene measures are necessary regardless of food type. What the research means in plain terms: wet food creates a more favorable environment for plaque bacteria to accumulate and persist on the tooth surface, because unlike dry kibble, it provides no mechanical abrasion during chewing. This is the specific mechanism. Kibble's texture physically scrubs tooth surfaces with each bite. Wet food does not. Over weeks, months, and years, this difference shows up in the oral microbiome. This does not mean wet-fed dogs inevitably develop dental disease. It means that wet-fed dogs require active dental hygiene, regular brushing, dental chews, veterinary cleanings that dry-fed dogs can partially but not entirely substitute with food texture alone. The Wallace et al. 2025 BMC study made this explicit. Additional methods to maintain dental hygiene should be promoted regardless of diet format. The honest summary: wet food benefits the kidneys and bladder. Dry food benefits the teeth modestly, incompletely, and never as a substitute for brushing, but meaningfully. This is why the most common veterinary recommendation is not one or the other, but a combination. 4. Their digestion tends to do well. For most dogs, switching to or continuing on wet food produces noticeably positive digestive outcomes. Wet food is generally more digestible, meaning a higher proportion of the nutrients it contains are actually absorbed and utilized by the body, rather than passing through as waste. The higher moisture content assists peristalsis, the muscular movement that propels food through the digestive tract. And for dogs with sensitive stomachs, food intolerances, or inflammatory bowel conditions, the softer texture and often simpler ingredient profile of many wet foods is easier to manage. Senior dogs and puppies specifically benefit from wet food's digestibility. Older dogs with dental pain, and the American Veterinary Medical Association estimates that 80% of dogs over 7 years old show some degree of dental disease often cannot chew dry kibble without significant discomfort. Wet food allows them to continue eating adequate nutrition without the mechanical challenge that hard food presents. Similarly, puppies transitioning from mother's milk have digestive systems still developing their enzyme capacity, and wet food's softer texture eases that transition. For dogs with reduced appetite, those recovering from illness, those on medications that affect appetite, or those who are simply picky, wet food's superior palatability is not a trivial benefit. The richer aroma and softer texture activate appetite responses that dry kibble often cannot match. A dog who eats consistently and enthusiastically is a dog who is getting the nutrition they need. That matters. 5. Their weight may be easier to manage with caveats. Wet food is generally lower in carbohydrates and higher in protein and fat relative to its caloric content than standard dry kibble. Many dry foods are manufactured using starch-based binding processes that significantly increase the carbohydrate content of the final product, a necessary consequence of the extrusion process used to form kibble. Wet food does not require these binding starches, allowing for formulations that more closely resemble the macronutrient profile of a carnivore's natural diet. For dogs prone to weight gain, diabetes management, or metabolic conditions where carbohydrate intake matters, this difference is clinically relevant. Wet food can support satiety at lower caloric intake because its high moisture content adds physical volume without adding energy. A dog eating 200 grams of wet food may feel fuller than a dog eating a 50-gram serving of equivalent caloric kibble simply because the volume and weight of the meal are larger. The caveat is portion management. Wet food's caloric density per gram is lower, which means the per meal quantity is higher by volume, and some owners misread volume as caloric equivalence. A dog who is given wet food in quantities calibrated to the kibble portions they were previously eating is often underfed. A dog who is given wet food in quantities calibrated to how much they seem to want can be overfed. Precise portion control using AAFCO-compliant feeding guidelines on the product label, adjusted for your dog's body condition score, matters more with wet food than owners often realize. 6. What the research actually recommends and what the science says every wet food owner should do. The picture that emerges from the accumulated research is not wet food is better or dry food is better. It is wet food and dry food each do specific things well, and the dogs who do best tend to eat both, or eat wet food with active dental care in place. The 75/25 kibble-to-wet ratio by caloric content is the most commonly cited veterinary recommendation for owners who want the hydration and palatability benefits of wet food while retaining some mechanical dental benefit from kibble texture. This is not a rule, it is a starting point. Dogs with kidney disease, urinary stone history, diabetes, or food sensitivities may do better on a higher proportion of wet food or exclusively wet food. Dogs with significant dental disease may need exclusively soft food for comfort. The specific dog, the specific health history, and the specific life stage determine the optimal proportion. What every owner of a dog eating wet food daily should do: brush their teeth. Not occasionally, regularly. The Ober et al. 2022 study and the Wallace et al. 2025 study both concluded that diet format alone does not determine oral health outcomes. Dental hygiene practices do. Toothbrushing, veterinary dental cleanings on a schedule recommended by your vet, and dental chews that have the VOHC, Veterinary Oral Health Council, seal of acceptance, are the interventions that actually move the needle on canine dental disease. Wet food without dental hygiene leaves your dog's teeth unprotected. Wet food with consistent dental hygiene leaves your dog with both the hydration benefit and a protected mouth. Monitor body condition. Because wet food's caloric density is lower per gram, portion accuracy matters more. Use your dog's body condition score, the visual and tactile assessment of whether you can feel ribs easily without pressing hard, whether there is a visible waist, whether the abdomen tucks upward rather than relying on your intuition about whether the bowl looks full enough. Ensure the food is complete and balanced. Any wet food fed as a primary diet should carry an AAFCO nutritional adequacy statement for your dog's appropriate life stage. This is not marketing language, it means the food has been formulated or tested to meet the minimum nutritional requirements your dog's body needs to function across every system. Without this, wet food can be palatable and hydrating while leaving nutritional gaps that accumulate over months and years. What actually happens to your dog when you feed them wet food every day? Their hydration improves. Their urine becomes more dilute, meaningfully reducing the risk of urinary crystals and supporting kidney function. Their digestion is often easier, their appetite more consistent, and their palatability experience richer. But without active dental hygiene, their plaque accumulation increases, the oral microbiome shifts toward bacteria associated with periodontal disease over dry food peers. And without careful portion management, their weight can drift in either direction. The science does not make the decision simple, but it makes it specific. And specific is what your dog needs from you.